If everyone could please rise for our invocation.
Thank you, Chairman Carter. Would you bow your heads with me in prayer? Lord our God, we pause for a moment as we convene our meeting this day. We have agendas to follow. We have commendations to bestow. There are finances to be examined and reports to be given. And we pray this day that you would remind us afresh and anew that every effort we make to support this great institution of healing is an effort simply to help those who come to us for care. Bless the efforts of our staff and this, our hospital board, as we seek to provide competent and compassionate care to our patients and to their families. These things together we pray. Amen.
Amen.
Please join me in the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, God, indivisible, with liberty and justice for all.
I'd like to call the meeting to order of the Sarasota County Public Hospital Board, and we'll start with our comment that any citizen desiring to address the hospital board should turn in a speaker card to the board secretary. If the citizen comment pertains to an item on the agenda today, the comment will be heard early in this meeting. Otherwise, it will be heard towards the end. Speakers are asked to limit their comments to 5 minutes. Vendors, suppliers, or other persons seeking hospital contracts awarded on a competitive basis are reminded that their ability to address the board may be restricted by the terms of the invitation for bid, request for proposal, or other purchasing criteria. Lastly, the board has established a claims adjustment review panel comprised of representatives of the board, the medical staff, administration, and legal counsel to review and negotiate the settlement of claims. Accordingly, the board will not entertain comments on or discuss or negotiate claims at this meeting. Our first agenda item today is the approval of the orders of the day.
So move.
We have a motion and a second. Any comments? If not, the orders are approved as presented, and then we'll have the approval of minutes of our meeting of February 21st.
So move.
Second.
And if there are no comments or questions, those minutes are approved also. Thank you. I don't think we have any board reports, so we'll start with our presentation today of the Dragonfly Recognition Program, and this will be presented by Dr. Joelle Vlahakis, and she is currently the Medical Director of Supportive Care Services and Associate Medical Director of Medical Management at Sarasota Memorial Hospital, and she is prior Chief Medical Officer at Tidewell Hospice, a large nonprofit organization, and co-chair of Bioethics Committee here at the hospital. And currently her focus is to extend the reach of palliative care services in her community, and her passion is to promote quality, high-value, patient-centered medical care for all patients, regardless of the seriousness of their disease or ability to pay. So, Doctor, welcome.
Thank you so much. So the supportive care team, that's what we call palliative care here at the hospital. We meet once a week, and we have rounds where we go over cases that may be especially difficult, and we talk about some of the latest advances in palliative medicine, but we always start our meeting with a recognition. And for us, we understand, as small of a team as we are, we never do it alone. That giving high-quality care, even if we're at the lead, is always a multi-person, multidisciplinary job. And so when we get extraordinary help, we make sure that we recognize it. We picked the Dragonfly because in addition to the fact that it's a transformation, very much like butterflies, we feel in palliative care we need to be a little more than what is often considered a hospice type symbol. So for us, the dragonflies really represent the ability to change quickly. Dragonflies go through a lot of transformation in their very, very short lives, and they become typically more beautiful with time. They're very powerful flyers. They're very flexible, and they can often change and move in ways that you didn't expect. So we also happened to be at a memorial service, or a series of memorial service, for one of our first patients that we took care of in palliative care. And we all had this funny thing happen to us in that we had a single dragonfly that pestered us, but we had all gone to different services. So we thought, okay, bingo, we got it. That's exactly what we need to do. So we honor our colleagues when they do something extraordinary. Recently, we had an RN who had never done this before, had never helped somebody through end of life, and she did such an extraordinary job. I had no idea that it was the first time she had done it. And her, not just the nurse, but her supervisor was so excited about it that he had somebody on his floor who had been recognized for this. We've had some tearful moments where nurses confide to us that, gosh, it came at the exact moment. We also make sure that, just like we like to think of ourselves as interdisciplinary, we give it to people of all disciplines. So we've given it to mobility techs before. There's a large number of people who've gotten it from the float team, not just cancer floors and ICU, although they would certainly be well represented. So we can't thank those folks enough for supporting the work we do. And I also would be remiss if I didn't say that supporting supportive care takes a bit of courage and flexibility and being powerful. And so each of you has been awarded a Dragonfly today as thanks for your support of our program. So go forth, sally forth. Thank you very much.
Thank you very much, Doctor. Our next item is the Excel award winner for March.
You ready for me, Mr. Chairman?
Go ahead, David.
Okay. So our award, Excel award winner for March 2017 is Rachel Pierce. Rachel, you here? Come on up. Are we taking pictures? Hold on, I have button my jacket and all here. Hold on. All right. Come on, man. All right. Rachel Pierce is our March Excel Award winner. Rachel is a clinical coordinator in our infusion center. She's been with Sarasota Memorial since 2006. Rachel's clinical coordinator role is a recent promotion, well earned, her nominees say, through hard work and a professional attitude. She began as a staff nurse in a unit formerly known as day treatment. When she became the unit's charge nurse, her peers noticed Rachel's collaborative skills as well as her expertise as an infusion and oncology nurse. In 2013, Rachel stepped out of her comfort zone to take on a part-time reimbursement RN role, where she had to audit and correct outpatient charges, research patient insurance, and obtain authorizations. She worked with our patient financial services and oncology navigator to help patients with their care. Her co-workers say Rachel receives many compliments from physician offices about her problem-solving capabilities. They say she's a pleasure to work with, and her co-workers couldn't agree more. Congratulations, and thank you for everything.
Rachel, I get the privilege of presenting this on behalf of the board and management. This is the Excel Award. Excel recipients are employees who are models of excellence and consistently demonstrate the mission, vision, and values of our organization. They are superior performers that make an extra effort in the quality and care of our patients and families in the community. The hospital board and administrative staff of Sarasota Memorial Healthcare Systems recognizes Rachel Pierce with the Excel Award for the month of March 2017 by our leader here, David Verender, the president CEO, and our fearless chairman, Greg Carter. Congratulations.
Thank you so much. Thank you. Thank you very much for this. This was quite a surprise, but I am honored and flattered to be with such an esteemed group in this hospital. Thank you.
I think the next award is 2 people this time, David?
It is.
Good.
So I would, so next I get the honor of introducing our employees, which is the first time that's happened, of the year for 2017. So I'd like to invite Carlos and Clara Rock to come up with me. Y'all come stand by me first. Are they doing pictures again or not? Okay, good. All right. So, for the first time in Sarasota Memorial history, it's 91 years, anybody's counting, okay? We not only have a tie for Excel Employee of the Year award, but our winners are husband and wife, Carlos and Clara Rock. So, Clara Rock is an RN in Labor and Delivery, OBECC. She has been with Sarasota Memorial since 1976. That's 40 years of dedicated service. Nominations came from everyone, longtime coworkers to new nurse graduates. One of the most common themes among them is Clara has your back. Her coworkers describe her as calm, cool, and collected. She makes everyone feel safe. Ours is a pretty stressful environment, one coworker says. Clara is a valuable, critical thinker in our OB emergencies, and her experience lends patients and staff with a special mix of firmness and compassion, they say, like a mom. Someone who also knows his job well is Carlos Rock, hospitality service lead in our Central Transport Department. Carlos has been at Sarasota Memorial since 2000. Among his many nominations, there's also a common theme, respect. Carlos, they all agree, is always respectful to others. He greets everyone with a smile. He is fondly referred to as the Rock, because it's his last name, of course, but and because he's someone you can always rely on, his coworkers confirm. He's an excellent trainer for new hires and an expert cross-trainer for staff. He goes out of his way, as peers summarize, Carlos has that winning attitude you wish every employee had. So here we have the Rocks, both Carlos and Clara. Each works in a different area of the hospital, and each has earned the highest employee recognition in the same year. It isn't a candid camera it isn't camera candid special. It isn't some special exception we made either. It's just very special. Because when you think about it, those 2 highly skilled, hardworking, and clearly respected employees who could choose to work anywhere chose to work here. Thank you both for everything.
Here, let me stand a little bit taller.
All right, you guys know the drill. I need to hear from both of you up here. Come on, Claire.
It's been this is an awesome place to work. What can I say? 40 years. I remember when I started, I was still in high school. My oldest son is 41. He was a baby when I started here. And it's just, I've enjoyed the ride. I don't know when it's going to end, but as long as I'm here, I'm going to enjoy it. It is an awesome place to work. It really is.
I really enjoy working here myself. I met my wife here. When I got the job here, somebody in my department convinced me to be a transporter. I started out in linen. So he told me, he said, I don't know anything about linen, so we're going to be partners, and I need to get you in transport. And I said, no, I'm not good at that. He said, I think you're going to be very good. That's my supervisor, Phil Wheeler. And he been standing side by side with me and showed me a few things, and I just took it from there. This is a very caring place. I really like working here. And I try to do the same thing with my patients and people that I run into with a smile and a caring attitude at all times. So I really appreciate y'all giving us this opportunity and this award for us. Thank you.
Very nice.
you know, it really is special to have them here. And I'll tell you, I know a lot of you walk around the halls and come and see people here frequently. You always see Carlos in the halls, and really appreciate their dedication.
Okay.
So, Mr. Chairman, keep going?
Go right ahead.
Okay. Next, we have our Physician Excel Award winner for the fourth quarter 2016, and I'd like to invite up Dr. Faisal King. Dr. King. Dr. Keene is our Physician Excel Award winner for the fourth quarter 2016. Dr. Keene is an internal medicine hospitalist and has been on staff since 2015. In the past year, Dr. Keene has spearheaded many initiatives important to our medical staff in improving patient quality, including the IPASS project between hospitalists and the ECC and the ACU/SIBR pilot project. He has also been working closely with Dr. Wilhelmina Visa-Ramesh to create a call and rounding schedule for the hospitalists that will better incorporate our upcoming residency program. A valued physician leader among his colleagues, Dr. Keene has become a voice and advocate for the hospitalists as they become a more critical part of our medical staff. His peers describe Dr. Keene as always looking for ways to both improve patient care and the well-being of our colleagues. Dr. Keene is respected and admired for his calm demeanor, earnestness, and fantastic moral compass. His peers agree he inspires us all to do better. Thank you so much. Thank you.
Dr. King, if I can present this plaque, it's for the Physician Excel recipients, or physicians who are recognized as role models of excellence, superior in performance. They are leaders who consistently demonstrate a collaborative team approach in their work. These individuals strengthen the quality of patient care and the image of Sarasota Memorial Healthcare System in our community. The hospital board and administrative staff recognizes Dr. Faisal King with the Excel Award for the fourth quarter of 2016, signed by David Verinder and Greg Carter. Congratulations, Doctor. Thank you for your service. All right, I got to get back up here. Got to balance these things out.
Thank you.
Thank you.
Thank you very much.
Come say a few words.
First of all, it's an honor to be here. I want to thank all of you for your time. I have been here for just over a year. I have worked in multiple other hospitals in different countries, and I can tell you that this place feels different. It's like a family, as you can see, some of my colleagues, some of my other co-workers. It's a special place, and I want to thank all of you, especially David, for you to keep it like that. Thank you very much.
Should I continue, Mr. Chairman?
Why don't you continue, David?
Okay. So happy to introduce to you our Leadership Award for first quarter of 2017. Alan Harris. Alan, come on up. You have a particularly hard job at work. Doing well.
Yeah, I'm doing well.
Good. Alan Harris is our Leadership Award winner for the first quarter. Alan is a project coordinator in the architecture and construction, and although his official start date is 1994, he's actually been with Sarasota Memorial since 1992. Alan received such high praise from his nominators, it's like getting a perfect inspection report, except this one's from his peers instead of ACA. So here's what they had to say. Alan is our project coordinator extraordinaire. He's our trusted liaison between SMH and all the plans, reviews, and inspection teams for the state, county, and city. He applies sound decision-making to a broad range of complex projects with tight budgets and timelines, and he always takes time to explain the project and answer questions. Alan is kind, courteous, and extremely patient. One coworker who's worked for Alan for many years says he's a man of few words, but his knowledge of SMH and the healthcare construction industry is unsurpassed. You can always count on him. and we sure can. Did you know that in 32 years here, Alan Harris has never failed an ACA plans review or a final inspection or capital construction project? Congratulations.
Oh, we're going to do the picture first?
No, I'm sorry.
No, don't let me mess you up. Alan, this is a beautiful plaque recognizing the Leadership Award, and there's a quote on it from the second President of the United States, John Quincy Adams. No, I'm sorry, he would be the seventh.
Don't look at me.
I don't say the seventh. This is the son. Anyway, but the quote is, if your actions inspire others to dream more, learn more, do more, and become more, you are a leader. The hospital board and administrative staff of Sarasota Memorial Healthcare System present Dale Allen Harris with the Leadership Award for the first quarter of 2017. Congratulations. All right, we're going to get our picture done.
Alan.
I just want to say I'm honored to accept this award, but I want to give a special thanks to my department, Architecture and Construction, Tom Perigo, my director, for the support of all these many years that I've been work here. So thank you very much.
Nope.
Do we have another, David?
I do.
Oh, good.
All right. So I'm honored to also get to present our Leader of the Year Award for 2017, and like to ask Lisa Collins-Brown to come up and join me. It's not a surprise this time, right?
No, no.
It was a management council. That was priceless.
Definitely a
So Lisa Collins-Brown is our Leader of the Year for 2016-2017. She is the Director of Patient Care in the ECC and the Endo Suite and has been with Sarasota Memorial since 2014. She was awarded her second quarter Leader Award in 2016. Lisa's co-workers describe her as a team player who consistently pitches in on the floor if needed. Kind and compassionate, she displays attributes she expects from her team. In other words, they say Lisa leads by example. Her peers appreciate her collaboration with all levels of nursing staff, executive leaders, and stakeholders. They describe her as effective, professional, and a master communicator. Most significant, Lisa's co-workers agree, has been her leadership in transforming the ECC into an environment of learning, growth, and respect. Lisa's positive thinking promotes cohesiveness and encouragement, they say. We function together as a team. In turn, our patient satisfaction scores have never been higher. Thank you, Lisa, for fostering an environment of mutual respect and teamwork. Your leadership by example is something we all admire. Thank you so much. Thank you.
Hi, thank you so much. Well, I've only been here since 2014, but I've been a nurse for 22 years. I know I don't look that old, but I'm just kidding. But I really appreciated every minute of working here. Every day you learn and grow, and it's a very supportive environment. I want to thank Connie, my boss, and she's very supportive. She, says yes to every cockamamie idea I come up with, so I appreciate that. But it's really trial by error and just listening to staff, and I have a great team, and like I said, lots of support, so I appreciate it. Thank you very much.
We're ready.
I'll be in the middle. How's that?
Perfect.
I'm about the same height. No.
This is perfect.
Thanks, Lisa.
David, I think we need one more.
I do.
Okay.
So we are privileged also today to have a Hero Award to give for March of 2017. So Marcia Button, can you come up and join me? Marcia? Is not here.
Accepting
So I'll tell you what, Mr. Carter, we'll postpone this one and give this to our next board meeting, if that's okay.
Sounds like a plan. Thank
All right,
you.
thank you.
Mhm. Okay, we'll move now to the report of the medical staff with our Chief of Staff, Dr. Scott Stevens.
The MEC met this month, and there was a recommendation to approve extending the moratorium closure of cardiovascular services.
All right, I'll make a motion in that regard. I move approval of an extension to March 2018 of the moratorium on accepting applications for new medical staff members for cardiac thoracic surgery as recommended by the Medical Executive Committee.
Second.
We have a motion and a second. Are there any comments, questions? Seeing none, all those in favor of the motion, please indicate by saying yes.
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 Opposed? Motion passes. Thank you. Thank you, Doctor. Our next item is the foundation report from the President, Mason Ayers.
Mr. Chair, I wanted to open my comments with just making sure that everyone here got the latest edition of the Envision magazine. It was sent out a couple weeks ago. It featured our wonderful cardiology program, and we are busy working on the next edition, which is scheduled to go out late April, early May. Also wanted to take an opportunity to update you on some events that we have going on at the foundation. March 31st, we're going to have our donor preview of the new rehab facility. Had a chance a week ago or so to take a tour of the facility. It's unbelievable. And we look forward to being able to host our donors there on the 31st. We also are going to kick off our EPIC employee giving campaign on April 3rd. It's going to run through May 26th. And the money raised during the campaign will go towards staff education, facilities, equipment, and technology upgrades here at Sarasota Memorial Healthcare System. And then finally, on May 5th is our annual golf tournament at Laurel Oak Country Club. We still have sponsorship opportunities available for that event, and the proceeds from the tournament will benefit the Physician Endowment Fund, which provides continuing education opportunities for the Sarasota Memorial Hospital staff to gain certification in new areas and update existing credentials. That is my report today, Mr. Chair.
Good. Thank you very much. Good report. Now we'll go for our Secretary's report. Tram Hudson.
Mr. Chairman, I would call the board's attention to several meetings in the month of April. On Thursday, April the 6th, 4:30 to 6 p.m., the service anniversary celebration will be held in the auditorium. On Monday, April the 17th, we have a series of meetings beginning at 9 o'clock. The Finance Committee will meet at 10:30. The Quality Committee will meet at 12 noon. Peer review will be held. We'll have financial review beginning at 12:30, and we'll have our board meeting at 2 o'clock on April the 17th. That's all I have to report.
Thank you, Tram. Now our Treasurer's report. Jim Meister.
Thank you, Mr. Chairman. A proposed motion. I move approval of the bad debt and charity care for the month ended February 28, 2017 in the amount of $17,591,000.
We have a motion and a second. Are there any questions or comments for Jim? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. Now we have the financial highlights from our Chief Financial Officer, Bill Wolgen.
Thank you, Mr. Chairman. Good afternoon, everyone. So for February's financial highlights, I wanted to point out this is the 5th month of our fiscal year, so the fiscal year to date numbers represent 5 months of activity. And starting with operating revenue for the system, for the month of February, we had operating revenue of $62,567,000 compared to a budget of $62,283,000. Fiscal year to date, $310,668,000 compared to a budget of $300,632,000. Total expenses for the system for the month of February, $59,707,000 compared to a budget of $60,211,000. And fiscal year to date, total expenses of $300,725,000 compared to a budget of $296,888,000. The system's operating income in the rating agency format for February, $5,774,000, which generated an operating margin of 8.6%, compared to a budget of $5,167,000, budgeted operating margin of 7.8%. Through 5 months of our fiscal year, operating income of $24,900,000 for an operating margin of 7.5%, comparing favorably to the budget of $19,217,000, budgeted operating margin of 6%. Moving to statistics for the hospital, these are fiscal year-to-date numbers. Average daily occupancy, 485 patients compared to a budget of 479. Our average length of stay so far this year, 4.44, which is lower than the 4.68 days average length of stay prior year. Admissions so far this fiscal year, 14,149, compared to a budget of 12,868. Surgery cases at the hospital, 9,231 so far this fiscal year, compared to a budget of 9,105. And so far this fiscal year, we've had 1,452 births, compared to a budget of 1,401. Outpatient registrations in 5 months, 185,470, compared to a budget of 185,489. And registrations to our emergency care centers combined 52,461, compared to a budget of 53,131. So far this fiscal year, our case mix index for all patients stands at 1.87, and for Medicare patients, 1.99. Mr. Chairman, that concludes my report unless there's any questions.
Any questions for Bill? Okay, thank you, Bill, very much. And now we'll move to committee reports, and I'm going to temporarily pass the gavel to my vice chair,
Doctor. There you go.
Yeah,
All right.
to Joe DiVirgilio, and give this report in my capacity as the chair of our board's governance committee. In today's governance committee meeting, we discussed the board's annual self-assessment, which gives the board members an opportunity to review our own processes and measure our performance against recommended governance practices. We do this through the Governance Institute. We will report on the results of that assessment once they have been collected and evaluated. We also evaluated our board bylaws, and the committee is recommending making some changes to the committee meeting requirements. And I have a motion in that regard, and I move approval of the amendments to the board bylaws to increase flexibility in scheduling committee meetings as recommended by the Governance Committee.
Do I have a motion in that regard? A second? Okay. Any questions or comments? All those in favor of the motion, please signify by saying yes.
Yes.
Opposed? Okay. I hand the gavel back to you.
No.
Not yet.
No, not yet.
Not yet.
Huh? Oh, geez, they screwed that up already.
2 more items.
All right.
You almost got away with it.
There you go.
As part of the Governance Committee responsibilities, we also conduct routine reviews of board policies. And I have a motion regarding 2 board policies, which we reviewed, but to which we did not make material changes. I move approval of the board's policies regarding transparency in public reporting and safety net and other community benefit programs as recommended by the Governance Committee.
Do we have a second?
Second.
Any questions, comments? All those in favor signify by saying yes.
Yes.
Anybody opposed? Now can I hand it back?
Not yet.
We keep trying.
If I may, I have one more
Certainly.
item for
You gave
information.
David 7 opportunities, so I can give you 3, you know?
Lastly, we had 2 board members, Joe DiVirgilio and Tram Hudson, provided information on the Governance Institute programs they had attended. Some of the key takeaways included the continued importance of population health initiatives, including the increasing use of data mining for diagnostic and other health care decisions. The governance responsibilities around the triple aim physician engagement strategies and integration strategies. The changing outlook of the healthcare consumer, including the growing force of the informed healthcare consumer and the susceptibility of the industry to a disruptor. And that concludes the report.
Well, very good. And you can have back the chairmanship.
Okay. Thank you, Joe, very
You're
much.
very welcome.
And our next committee report is the Audit Committee. Mr. Henry.
Thank you, Mr. Chairman. The March meeting of the Audit Committee was held this very morning at 7:30 a.m. The minutes of the January meeting were approved. David Hess and Maureen Pingree of the Bobbitt, Pittenger and Company presented the results of the fiscal year 2015-2016 audit, the financial statements of the Sarasota Memorial Healthcare Retirement Plan. They reported that the audit went well and summarized that summarized the numbers as of September 30th. The auditors reported there were no noted deficiencies. Translate that means there were 0 deficiencies. Try that, you people who have done audits in the past. 0 deficiencies. Congratulations to Executive Staff Mark Thornton and his aide Tisa. I have a motion to offer, please. I move acceptance of the Bobbitt, Pittenger and Company FY 2015-2016 audit of the Sarasota Memorial Healthcare Retirement System plan as recommended by the Audit Committee.
Second.
We have a motion and a second. Any questions or comments? Seeing none, all those in favor of the motion, please indicate by saying yes.
Yes.
Opposed? Motion passes. Thank you. That concludes your report?
Okay, wait a minute, I'll do it right. That concludes my report.
Oh, okay.
How's that?
Thank you, Darrell.
Perfect.
No problem.
I didn't want to cut you off in case you had more.
Always got more. Try not to do that.
Next, we have the President's report. David Verner, our President and CEO.
Thank you, Mr. Chairman. I'm going to start today, like we do each month, but looking at our organizational report card. This is for our fiscal year to date through February of 2017. We will start with our service pillar and look at our HCAHPS numbers. We have a goal of being 8 out of 11 of the domains being at the 50th percentile or higher. We are currently at 7 out of 11, so falling one short, and I'll show you the detail on that here on the next slide. On the outpatient side, we have a goal of being at 55 out of 58 of the domains, and the outpatient side of being the 50th percentile or greater. I'm happy to report we are maintaining our 56 out of 58, so doing just slightly better in goal. In the people pillar, we have turnover of part-time and full-time employees that have been hired in the last 12 months. We have a goal of being 25% or lower on turnover. This is a rolling 12-month goal. We ticked up a little bit this month, so we're just slightly above our target at 25.36%. In a quality pillar, we have our infection prevention, which is combined overall standardized infection rate. We have a goal of being below 0.95. Happy to report that we are maintaining much lower than that at 0.84. Just a little further on that, the national average or the expected rate is 1.0. So I would thank all of our folks for doing great there. In the finance pillar, you've already heard from our CFO, Bill Wojcik. We have a goal of making 5.1% margin. We're currently tracking at 5.8%. And in a growth pillar, we have 2 goals, one being the inpatient admits and observation patients being at 38,899 for the year. We're currently tracking in excess of that at 43,561. On the outpatient side, we have a goal of being at 799,000 patient registrations. We are tracking a little bit lower than that right now at 786,966. So when we look at our HCAHPS report card, you can see we are 7 domains out of 11, which is the number we've been at for the last month or so. And you can see it's the same areas that we're struggling with in responsiveness of hospital staff, communication with doctors, cleanliness of the hospital environment, and quietness of the environment. So teams that are continuing to work on that and making good movement, but it is a difficult process. But I will tell you, our staff is dedicated around this. Next, we have, I'm going to move into the people section. We're going to start with Suncoast Blood Bank, which is, of course, who we use for our blood services and our partner. So Suncoast Blood Bank Hospital Drive was March 14th through the 17th of this year. And we gave a free T-shirt to those who donated. You see a picture there of Sean Hall's being drained of blood. So we appreciate we appreciate him being a good sport and smiling while he's doing it.
Pardon interruption, David.
Yes, sir.
I saw a T-shirt the other day, talked about giving blood.
Yes, sir.
It said, "Give blood, starve a mosquito."
Well, there you go. You like that one? We'll pass that on. It may have been Suncoast's, but we'll pass that along. Staying in the people section, SMH represented at the Northport Business and Community Expo. So we recently participated in the 31st Annual Business and Community Expo, which was March 4th, 2017, hosted by the Northport Area Chamber of Commerce. More than 450 residents of South County area attended the event, which included businesses and community members promoting their products and services. Live demonstrations, hands-on children's activities, giveaways, raffle prizes, refreshments, and more. And we just really want to thank the people of Northport for their support and for allowing us to come out and be part of it. We also support ALS research. So we had a walk to defeat ALS. Sarasota Memorial was proud to sponsor the recent walk to defeat ALS on March 4th, 2017 at Philippi Estate Park. Proceeds support the ALS Association's quest to treat and find a cure. So appreciate all the employees and community that came out for that. Staying in the people section, we had Sarasota Memorial staff participated in a Sarasota High School career fair at the Selby Library on February 27th, 2017, providing education and career information to students. So you see some of our staff there at our booth, but we really believe strongly in this and getting people, young folks involved in the healthcare sciences early. And hopefully encourage them to go to school and become incredible caregivers in our community. So Sarasota emergency staff also manned first aid tent. Members of Sarasota Memorial's Emergency Care Center and trauma teams staffed the first aid tent at the recent United Way Suncoast Obstacle Course race held at the Celery Fields on February 18th, 2017. So thank you to all the staff who showed up for that as well. This is a slide that I've had in a couple of presentations now. Just to let you know, we're always seeking volunteers. Our volunteers play a very large role in this organization. We have about 1,000 of them. We're always looking to add to our ranks. So if you know someone who would like to make a difference in patient lives, tell them about our wonderful volunteer program. Wide range of opportunities available, including providing patient support on nursing units, helping in the gift shop, discharge services, perioperative reception, transport, and other areas. Volunteers receive a free meal, free TB, and other screenings, use of the patient-employee library, and other benefits. So please contact our director there, Stacy Scott Berteau, and at the number listed. Sarasota Memorial is listed in Becker's Healthcare 150 Great Places to Work. Sarasota Memorial Healthcare System is one of the best according to Becker's Hospital Review, which included our organization again in its annual list of 150 great places to work in healthcare. We also made the list for the first time last year in 2016, an annual tribute to U.S. hospitals, health systems, and healthcare companies to demonstrate the greatest commitment to fulfilling mission, creating outstanding cultures, and providing competitive benefits to all of our employees. So what it really comes back to is it connects our employees and makes sure it's an indication our employees are engaged in our mission and what we do each and every day. So we thank them all for what they do. Staying in quality, SMH cardiac team receives highest ratings. Sarasota Memorial Hospital has earned 3-star ratings from the Society of Thoracic Surgeons for overall quality and clinical outcomes in all 3 adult cardiac surgery procedures the national organization measures: aortic valve replacement, coronary artery bypass grafting, and surgery that combines the 2 procedures. The 3-star rating, which denote the highest category of quality, place SMH's cardiac surgeons among the best of the nearly 4,000 surgeons and providers in the United States and Canada participating in the STS Adult Cardiac Surgery Database. Only 11 participating hospitals achieved the 3-star rating across the board. So you can see below a picture of all 5 of our surgeons, from Dr. Sell, Dr. Kelly, Dr. Vesco, Dr. Hoffberger, and Dr. Fong. We are very proud of this, and just to be extra clear, 3-star is the highest star rating. It's not 3 out of 5, it's 3 out of 3. So please, if you see them, thank them for their work. New technology orchestrates flow of surgery patients. As patient volumes continue to grow, Sarasota Memorial has been focused on improving flow and capacity on the hospital's main campus. Now SMH is working to enhance capacity and patient throughput in the surgery department, which has seen an increase of 12% since 2013, a jump that's been fueled in part by the opening of SMH's trauma center, with the increase in the number of complexity of surgical cases. Ensuring that surgery operates as efficiently as possible is really one of our top priorities. We have adopted the Orchestrates system, a PC-driven workflow technology from teletracking. Similar to an air traffic control system, Orchestrate tracks patients and staff and records, documents and automates workflows based on moment-by-moment care milestones throughout the surgery process. As a result, the team can monitor patients' real-time status and a location in each phase of surgery and address potential delays more quickly and effectively. So it really is quite a process that goes on. Lori, we really appreciate everything you do to help get us there and continue to drive that. So thank you. Staying in quality, March is our National Professional Social Work Month. So celebrated each March, National Professional Social Work Month is an opportunity for social workers across the country to turn the spotlight on the profession and highlight the important contributions they make to society. Our nation's more than 600,000 social workers have amazing tenacity and talent. They confront some of the most challenging issues facing individuals, families, communities, and society, and forge solutions that help people reach their full potential and make our nation a better place to live. In the Integrated Case Management Department, as well as in others in the organization, we have a talented team of psychosocial case managers. SMH celebrates the contributions of social workers during National Social Work Month. So, hug a social worker. That's the bottom line. Staying in quality, we have a new program focuses on workplace wellness. In recent months, a special health and wellness committee, which is made up of staff and leaders from around our health system, have been working to support workside culture that supports employees' desire to live a healthier lifestyle and embrace wellness. The group has developed a plan to promote awareness about specific health and wellness topic each month with special activities for staff and visitors. In addition, throughout March, special activities and displays will help celebrate National Nutrition Month. The theme of this year's celebration is Put Your Best Fork Forward, which serves as a reminder that each of us holds this tool to make healthier food choices. As always, we have free lecture series that we provide that are open to the public. These are on our website. I don't expect anybody to actually be able to read the small print here, but I would encourage you to go to our website and take a look and utilize these free lecture series. We are also having a Meet Our Bariatric Surgeons events on Thursday evenings from 6 to 7:30. Once again, you can see this on our website and for times and locations. Our rehab pavilion grand opening is set for April 1st. We hope everyone, and certainly everyone in the public and associated with the organization is more than welcome. It is from 9 o'clock till noon, Saturday, April 1st. We hope to see you out there. It really is an amazing building and something that our organization is very proud of and looking forward to serving our patients in it. And finally, we wanted to just welcome two new physicians to First Physicians Group, Dr. Sam Grissom, who's going to be working in that rehab hospital. He is certified in physical medicine and rehab, and also Dr. Rao, who is coming to us as a bariatric surgeon. So we're looking forward to both of them coming on campus in very, very quickly. Thank you for everything. I'm happy to answer any questions if you have any.
No questions? Thank you, David.
Thanks.
Our next item is the consent agenda. I don't think we have anything on that. Public comments, Karen?
None.
Thank you. Legal matters, Carol Ann?
I have no report.
And we have any other business? If not, we are adjourned. Thank you very much. Better that time. Yeah, it did.
Well,